Mia, always great to chat to you. Let's start off with this. So we have already received a first batch of 80,000 Johnson & Johnson vaccines. How many have been administered to date?
By the end of yesterday, it was around about 64,000. Each day, the health department releases the statistics of the previous day as to how many were used by 6 p.m. the previous day. And for now, it's 64,000. Obviously, by the end of 6 p.m. today, it will be more. The health department says we're using about 12,000 vaccines a day at the moment.
So this second batch is also 80,000 doses, but we've ordered a total of 9 million doses from Johnson & Johnson. So tell us more about why we're receiving them in such small batches.
So we have two different types of consignments that we are going to receive in South Africa. At the moment, we are doing research with a batch that could go up to 500,000 vaccines of Johnson & Johnson in South Africa. Now, the reason that we're doing the research now and that we don't yet have the 9 million vaccines that we have procured from Johnson & Johnson is because before we can use a vaccine in the country, it needs to be registered by our medicine regulator, SAHPRA. And the reason it needs to be registered is to make sure that it is as safe and effective as Johnson & Johnson says it is. Now, to get a vaccine registered in the country, there are different ways to do it, and the different ways take different durations to get that approval. So to get the approval that Johnson & Johnson has applied for the 9 million vaccines, takes quite a time. It can take a couple of months. On average, we're looking at about 3 months here, according to Glenda Gray, one of the principal investigators of this trial. Now, we can either wait and have no vaccines in the country until we have the approval for the wider rollout of J&J, or we could do something else and see if there is a shorter approval that we can use in the meantime. And that is what South Africa has done. We have applied, Johnson & Johnson applied for approval for the South African Medical Research Council and the Health Department to conduct a research study on the Johnson & Johnson vaccine. And that took about 5 days to get. The application was submitted on a Monday, and by the Friday it was approved. So that is why we can now roll out the vaccine within a research setting, but that also means that it's not many vaccines. And the 500,000 vaccines that we're getting at the moment for research doesn't come from the 9 million that we ordered. It is research stock that J&J is allocating to South Africa, and we're getting that research stock for free.
Mia, the fact that the approval has not been granted yet, and the fact that we're using these doses for research might make some people nervous. First of all, is there any need for people to be nervous? And second of all, why is the approval taking so long when we're in the middle of a pandemic? Surely it could be speeded up.
So to your first question, no, I don't think anyone needs to be nervous, because this is not a trial that's going to retest if J&J is effective and safe. We already know, we have the data that has been released that it's effective and safe. What we are doing is, it's called an implementation study, so it looks at real life implementation issues of the vaccine. So in a trial where J&J evaluated whether it was whether efficacy was good, they used that in a very controlled setting, because in a trial you have things that you control to make sure that it works well. So for instance, you make sure all the vaccinators are trained in the same way, and you make sure that things go is operating according to a trial protocol. When it gets to real life, there are many things that you can't control. You, for instance, can't control always how the vaccines are transported, or if everyone is trained in the same way, or if all health workers are comfortable with getting a vaccine, or if all the or if everyone is available that need to provide the vaccinations. So this is not a trial where you're going to measure where some people get a dummy vaccine and some people get the real vaccine. All the health workers in this trial are getting the vaccine, and we're just looking at what issues come up when we implement this vaccine in real life. So with regards to whether we Sorry, I forgot your second question.
No, that's entirely my fault for asking two questions in one. Mia, my second question was about the length of time it's taking for that approval to come through. Is there any way to speed up the approval from SAPRA, given that we're in the middle of a global pandemic?
Yes, so SAPRA is actually already speeding up the approval processes for COVID vaccines. When any COVID vaccine or medicine applies for approval with SAPRA at the moment, it jumps to right in front of the queue and it gets priority treatment. So at the moment, there are some things that SAPRA could, for instance, not control. So things like if J&J has provided all the information they need. Now, you may ask a question such as the FDA, which is the United States medicine regulator, why have they had all the information to be able to very likely issue an approval, over the weekend or very early next week? Well, we have been dealing with the variant that has been identified in South Africa. So it's likely that SAPRA could require additional information on how the variant performed, the vaccine performed against the variant in South Africa. So this process that SAPRA is following is the only way that we can ensure that we're getting a safe and a good vaccine into the country. And it is not that SAPRA is taking extra long. Nobody in the world has approved this vaccine. And the reason is because it's so new. The J&J vaccine's results, the efficacy results, were only released a month ago on the 29th of January. For instance, if you want to compare it to, say, the AstraZeneca vaccine, the initial results of AstraZeneca was released way before the J&J vaccine. These are the latest vaccine results that we had. So it's the vaccine of which the last vaccine that we've seen, of which phase 3 trial results were released. So it really isn't as long as it looks like, because the vaccine is so incredibly new, and that is why no other regulator has approved it yet, because they're also still looking at the results.
Well, thank you very much for that update. That was Mia Malan, editor of the Bekisisa Centre for Health Journalism.